Amoeba species, Giardia lambia, and Entamoeba histolytica.
Amoeba have been found in soil, seawater, swimming pool, contact lens equipment, dialysis machine, heating, ventilating, and air conditioning, vegetable, human nostril and throat, human and animal brain, skin, and lung tissue. Amoeba has only two stages, cyst and trophozoite. In trophozoite, no flagellated stage exists as a part of the life cycle. The trophozoite replicates itself by mitosis. The trophozoite are the infective form, although both cyst and trophozoite can enter into the body through the various ways. Entry can occur through the eyes, the nasal passage to the lower respiratory tract, or the broken skin. When Amoeba enter the eyes, it can cause the severe keratitis in the healthy individual, particularly in contact lens user. When it enters the respiratory system or through the skin, it can invade the central nervous system by hematogenous dissemination, causing granulomatous amoebic encephalitis, disseminated disease, or skin lesion in individuals with compromised immune system. For the diagnosis stage, Amoeba, cyst, and trophozoite are found in tissue.
I have been suffering from eye infection last year. When I get the consultation from the doctor, he went through a lot of checking, or he told me that this is diagnosis. Eventually, he explained that I have been infected by the parasite called the Amoeba, and my disease is Amoeba keratitis. On that time, my eyes is very painful, and my eyes is low redness. I can't see very clearly, and my eyes become very sensitive to the light. I also feel like something inside my eyes, and I excess tear out of my eyes. The doctor was asking me what I did to my eyes. I was telling him that I used to wear the contact lens in every day, and I like to wash my contact lens using the running tap water. I also like to wear the contact lens during my swimming class so that I can see clearly. After the doctor hearing my history, doctor told me that I'm very lucky because I can get the consultant early. If not, I will become blind. For the treatment, I remember the doctor gave me a lot of antibiotics. The drug which called the albendazole or talbendazole. I also have to follow up the medication very closely until the clinical response is seen. The doctor also told me that the surgery is needed if my infection becomes very serious. So luckily, it does not happen to me. I feel that I'm very lucky. Yeah, this is all the story from me.
This is the life cycle of Giardia lambia. The infections occur by ingestion of cysts, usually in contaminated water. Both cysts and trophozoite can be found in the feces. The cysts are hardy and can survive several months in the cold water. Infection occurs by the ingestion of cysts in contaminated water, food, or by the fecal-oral route, hands or fomites. In the small intestine, incestation releases trophozoite. Each cyst produces two trophozoite. Trophozoite multiply by longitudinal binary fission, remaining in the lumen of the proximal small bowel where they can be free or attached to the mucosa by a ventral sucking disc. Incestation occurs as the parasite transits toward the colon. The cyst is the stage found most commonly is no diarrheal feces because the cysts are infections when passed in the stool or shortly afterward. Person-to-person transmission is possible. While animals are infected with Giardia, their importance as a reservoir is unclear.
There are few signs and symptoms for Giardia lambia: fat malabsorption, inappropriate weight loss, diarrhea, epigastric pain, and buccal stole. It happens because trophozoite will attach to intestinal villi structure by using ventral sucking discs, and tips of villi become flattened. Therefore, it will shortening of villi. Then it impair absorption of folate and B12. It will cause megaloblastic anemia. Then it will impair absorption of water and electrolyte. So it will lead to diarrhea and lethargy. Giardia will use bile site to reduce digestion of fats by pancreatic lipase and will form greasy stool, which is steatorrhea for the early symptoms. For long-standing absorption problem, it so will cause malnutrition or stunted growth, especially in children. There are few drugs that are used for treatment giardiasis are metronidazole and tinidazole.
This is a life cycle of Entamoeba histolytica which will cause amebiasis. The life cycle begins with the cysts and trophozoite are passed in the feces. Cysts are typically found in the form stool, whereas trophozoite can be found in the diarrhea stool. Human can get infected by ingested of the matched cysts in fecally contaminated food, water and hands. When the matched cysts enter the gastrointestinal tract, it can pass through the stomach as cysts form able to survive in the high acidic environment. When the cysts arrive at the small intestine, it will excitation and release trophozoite, and then trophozoite will migrate to the large intestine and multiply through binary fusion and produce cysts. Both of these stages are passed in the feces. Cysts form able to survive these 2 weeks in the external environment and responsible for the next transmission. For the remaining trophozoite in the large intestine, it can cause bowel disease, and some will invade to the intestinal mucosa and infect other organs such as liver, lung and brain through bloodstream and cause pathologic manifestation. For this life cycle, cysts are the infective stage while the trophozoite is the diagnostic stage.
There is a few signs and symptoms for a patient who has been infected with Entamoeba histolytica, such as dysentery or bloody stool. It happens when trophozoite invade through the intestinal mucosa and lead to the formation of ulcer, also known as flash-shaped lesion. When the lesion breaks, it will cause bleeding to the intestinal. Next, hepatomegaly. It happens when trophozoite invade through the intestinal wall into the bloodstream and infect the liver. Besides that, fever and mild jaundice can be present, especially in karyotic and multiple abscess. For the treatment, the drug that has been used is metronidazole. Besides that, surgery also can be done, as indicated in the case of abscess involving left lobe and not responding to the treatment.
For the waterborne parasite disease, firstly, we can use serology to detect the antibody of the human to fight infection by the parasite. Next, we can use the molecular, especially for the PCR, which is a polymerase chain reaction, to detect the DNA of the parasite. And lastly, we can diagnose the disease using the biopsy method to get the cell from the human to detect the parasite content in the body. For the control and prevention for waterborne parasite disease, firstly, you need to boil the water at 100 degrees Celsius to ensure that the parasite contained in the water has been dead. Secondly, you need to purify the water and treat it using the purifier. Next, avoid using contaminated contact lens. And lastly, you need to avoid swim at the contaminated area.